Now, we think that we're going to go to health care coverage, and Congressman Chris Murphy, a Democrat from Connecticut, who is standing by with us now. Congressman, here's the key question. Do Democrats have the votes they need to pass health care legislation when the vote time comes later this evening?
We'll have the votes. We'll have the votes because America's been waiting a very long time for health care reform. My constituents need this. I have thousands of constituents who are going bankrupt because of health care costs and because of illness. I have businesses that just got notices that they're going to see a 30% increase in health care costs this year. And I have emergency rooms that are overloaded with people without insurance that need a real system of preventative care. So we're going to have the votes. I think it's important that the president is here, I think, making the final push. It's not going to be, I'm not saying it won't be close, but the American people elected President Obama and Democrats to Congress to deliver health care reform, and I think we'll do that this evening.
Congressman, there is a debate going on about the issue of abortion and whether federal dollars should be spent to fund abortions. It is a controversial issue, but how that is resolved could well mean whether or not this matter becomes law of the land, the health care legislation, or whether it doesn't become law of the land. Where are we in those negotiations?
Well, I think we're getting to a point of resolution. It's not necessarily one that a lot of us who are pro-choice are satisfied with, but I think we're getting to a resolution where we, through this legislation, will make firm the commitment that no federal dollars, either through government programs like Medicare and Medicaid or through the health care exchange that we're setting up, will go to pay for abortions. We'd still allow for people to buy riders on top of their policies to be able to pay for those kind of services, but I think we're getting to a resolution, and I think that's one of the reasons that you will see a positive vote this evening.
All right, and let me ask you the question. I mean, you say you think the votes will be there. Where are the votes right now? How short are they? I've heard as many as 5 or 10 votes.
No, I think the votes, listen, I'm not in charge of counting the votes, but I have a lot of colleagues who have been on the fence over the last few weeks, and I see them moving to a position of support. And I frankly think that the elections earlier this week have helped. We have 2 new members sworn in who both ran on platforms of supporting health care reform, including one from upstate New York who ran and won in a pretty Republican district. So I think that the Tuesday results, where the only 2 elections in the country where health care were on the ballot resulted in the election of pro-health care reform Democrats, have helped push some people over the finish line. I think the votes are there right now, and I think they'll be there tonight.
All right, Congressman, we greatly appreciate you. Chris Murphy, Democrat from Connecticut, someone who's in favor of this health care legislation. And